Tour de Cure. This is your day.
Every 17 seconds, someone is diagnosed with diabetes.
Since 1991, Tour de Cure and Step Out's fundraising efforts have supported advancements in diabetes research, provided education programming, and ensured that we can advocate for the more than 34 million Americans living with diabetes. Because of your support, we have accomplished so much together in the past 30 years, starting with the first diabetes cost reduction bill in Wisconsin in 1991. Since then, we've been able to pass similar bills in 45 states. We continued to ride and walk through the 90s, earning more advocacy wins along the way. In 1999, Virginia was the first state to pass the Safe at School bill to help make sure students receive proper diabetes care and are safe at school. Fast forward to the 2000s. As our events grew, so did our milestones. Starting with a bill in 2003, we supported bills throughout the 2000s that brought an end to discrimination against insulin-dependent commercial drivers and pilots. In 2013, we launched Pathway to Stop Diabetes, a bold, innovative initiative to find a new generation of brilliant scientists at the peak of their creativity. Then, provide them with the freedom, autonomy, and financial and professional resources to set them on the road to breakthrough discoveries. Then in 2018, we launched our Diabetes Food Hub, an online nutrition platform with recipes helping people with diabetes form healthier eating plans. And while these are just some of the milestones, each of them would not be possible without you. In fact, because of you and the millions of participants, sponsors, and volunteers, we've been able to raise over $500 million through Tour de Cure or Step Out since 1991. So thank you for your support through the years, and now we set our eyes on the future, with a goal to participate by standing, walking, and riding side by side as we stay vigorous in our fight to achieve our vision of a life free of diabetes and all its burdens.
We are connected for life.
Hello, everybody, and welcome to the 2021 Texas State of Diabetes Virtual Lunch Series. Please do say hello in the comment section and let us know where you are and where you're joining us from. In today's live webinar, we will be discussing taking action as a diabetes activist. My name is David Lopez, the Executive Director for the American Diabetes Association here in Texas. Our intent today is to bring together industry leaders, healthcare providers, innovative technology creators, and community members from across our state to share insights and find solutions to help people living with diabetes thrive. Panel discussions aim to affect positive change in health for people living with diabetes and their families, and to underserved communities. Together, we will address, explore, and inspire innovative solutions and resources that can be used to engage the community in diabetes management, prevention, and overall health and wellness. A special shout out thank you to our sponsors, Humana and the McGovern Medical School at UT Health, the Department of OBGYN. Now I would like to introduce a special message from Dr. Bob Gabbay, the Chief Scientific and Medical Officer for the American Diabetes Association.
Hello, everyone. Welcome to the Virtual State of Diabetes 2021. My name is Bob Gabbay. I'm the Chief Scientific and Medical Officer for the American Diabetes Association, sometimes known as Dr. Bob. And it is my pleasure to welcome you to our program today. Diabetes continues to be an incredible public health problem. Literally, there are 34 million people with diabetes, 88 million people with prediabetes. The vast majority of them don't even know they have prediabetes. Most of the diabetes in the US is type 2, something like 90%. And so why do we care so much about diabetes? Because it continues to be the leading cause of blindness, kidney failure, amputations, heart disease, stroke, so many devastating complications that can occur from the disease. The good news is that we can do something about all that, and that's why we're here today. The State of Diabetes aims to bring positive change, to educate us all, to share ideas, to problem solve, to figure out how do we make a dent in diabetes together. So, we've come to realize that to really solve the problems around diabetes, no one organization is going to do that alone. It's really going to be working together. Together, we can tackle this issue. So the state of diabetes is centered around the work we're doing at the American Diabetes Association around health equity. Why health equity? Well, the pandemic has shown a bright light on the incredible health disparities that exist in our society. And in many ways, diabetes is the poster child for that. Black Americans are twice as likely to develop diabetes. Black Americans are 3 times as likely to have an amputation. People of color are more likely to live in poverty, and poverty leads to significantly worse diabetes outcomes. So our State of Diabetes program is centered around our 5 pillars. What are those 5 pillars that we think if we address, we can deal with the health inequities that exist? The first one is cure, care, then cost, cuisine, and connect. And you'll hear these topics talked about during our State of Diabetes program. So thank you for joining this program. We hope you come away with not only greater knowledge, but passion to make a difference, to work together to improve the lives of those living with diabetes. Thank you.
Thank you, Dr. Bob. Once again, special thanks to our sponsors, Humana and the McGovern Medical School at UT Health, Department of OBGYN, for underwriting our 2021 Texas State of Diabetes virtual lunch series. We love engaging in an interactive exchange, so if you have a question or a comment anytime during our session, please enter it in the live chat section. We'll be answering as many of those as we can today. Also, we're just like everybody else. We love being loved. So do push the like button and cheer us on. Joining us today is Veronica de la Garza. Veronica has been with the ADA 18 years and is based in Austin. Her territory covers the 10-state region, including Texas, and she has over 22 years of experience working at the national and at the statewide levels in government affairs. At the American Diabetes Association, she's worked with many advocates, and together they have had successes in the area of access to adequate and affordable healthcare, diabetes research and programs, discrimination, coalition building, and working with advocates, in addition to all the other priorities of the ADA. So Veronica, take it away.
Good afternoon, everyone. Thank you, David and Dr. Gabe, for those introductory remarks. Again, I'm Veronica de la Garza, Director of State Government Affairs. I'm based in Austin. We have a slight change in our program. 2 of our original panelists were unable to attend, but we invited 2 other amazing diabetes advocates to join us. Also, we will take questions in the last 10 to 15 minutes of our time together. I am so happy to be here for what we hope is a fun, exciting panel that shows the range of our advocacy efforts that a diabetes activist can engage in. We have a fantastic speaker panel, and we are delighted they are here with us today. Let's get started. Our first panelist is Reva Verma. Reva is a small business owner. She is CEO of Reneka Digital, a full-service digital company here in Houston. Reva has held many leadership positions in the Houston Community Leadership Board, and we appreciate all her work in putting this panel together. Our next panelist is Sanchez from Austin. He is the co-chair of the ADA National Advocacy Committee. Louis is a 12th generation Texan and has been a longtime diabetes advocate since his mother started taking him to ADA events at the age of 13. He is a former chief of staff for a state senator, and we have benefited greatly from his leadership throughout the years. Our final panelist is Deirdre Murphy from San Antonio. She works in public health and is a local and national diabetes leader who has also served in many ADA positions and is someone that we turn to for counsel and advice. I will now give each panelist 5 minutes for their opening remarks and to tell us about their connection to diabetes advocacy and why it is important. Louis, we will start with you.
Hi, good afternoon, everyone. So my name is Louis Sanchez. As Veronica mentioned, well, I started as a volunteer pretty early in life, helping raise money for WALK and participating in that way. And through the years of volunteerism, I began to learn more about the organization and grow in my ability as a volunteer and as an advocate. I decided to commit myself to the association in memory of my grandmother, who passed away with complications related to her own diabetes. And it's in her memory that I continue as a volunteer today. That was, almost 30 years ago when I started my first walk. Today, I'm fortunate to serve as co-chair of the National Advocacy Committee. Over the past decade, I've committed myself to using my professional experience as a legislative staff in order to help shape the direction of the ADA's national and state public policy priorities. It's been really rewarding work, and certainly I've been able to witness the power of advocacy across the 50 states and the United States Congress. And that comes with support of individuals like you who are tuned in today. Advocacy is one of the very important pillars that makes ADA the foremost research organization and advocacy organization when it comes to helping people with diabetes. And when you think about the ADA's mission, it is to improve the lives of all people with diabetes. And one of the ways that we do that, and we're successful at doing that, is through our advocacy efforts. And so I want to thank you so much for tuning in today, for participating in this panel, and for asking your questions. We are here to be resources for you and to let you know that what you do in terms of advocacy really matters for all of the individuals across Texas. I'm looking at the banner there, 7.142 million individuals who are affected by diabetes in the state of Texas. And so we're so grateful that you're here. Keep up the good work. Continue to be strong advocates. Contact your local, state, and federal officials. It really does matter, and we'll talk a little bit more about that later. Thank you, Veronica.
Thank you so much. Reva, if you could go next.
Thank you, Veronica. If it's okay with you, I'd like to share my personal story, which will give insight into why I became a diabetes advocate. I've been a volunteer for the American Diabetes Association for many years. Like Veronica had mentioned, I am a small business owner here in Houston, and I have type 1 diabetes. I was diagnosed with type 1 diabetes when I was 11 years old. That is 18 years of nonstop 24/7 grind of dealing with diabetes, no breaks. Many others who also live with type 1 diabetes, those of us who are insulin dependent, never get to pretend like we don't have diabetes, not even for a few hours. Because if we do not inject insulin, our blood sugar rises and causes all kinds of short and long-term complications, from headaches and a foggy memory to irritability, loss of vision, limbs, organs, and much worse. The cost of insulin has risen significantly over the last few years. I am a small business owner that owns and operates a small digital marketing company. We are a young company, and our employees are generally healthy. In order to keep our health insurance costs in check, we contracted for high-deductible insurance plans for our employees, myself included. For the first few years, the plans worked out as the cost of insulin was manageable. However, over the past couple of years, insulin costs have soared. For the last 2 years, I was paying about $1,200 for 3 vials of Novolog, a 1-month supply, until my deductible was satisfied. Prior to this, it used to take me about 10 months to meet the deductible, but all of a sudden I was having to find the money over a 3-month period instead of 10. In order to spread the cost out over the year and not have a brutal cash drain over the first few months of the year, we were forced to upgrade to a lower deductible plan for all of our employees. While this plan helps to lower the out-of-pocket cost per trip to the pharmacy, the plan costs more overall, thus increasing our overhead and negatively impacting our bottom line. So while the cost is hidden in our day-to-day lives, it just kept draining my resources. The cost of having diabetes, as many people know, are numerous. They don't just include insulin. For example, I am fortunate enough to be on a continuous glucose monitor. However, that cost runs me an extra $3,000 a year. I became an advocate because I truly believe that no one should ever be put in a life or death position due to the rising cost of insulin, where they are constantly worried, should I buy my medication to keep me alive, or should I put food on the table? We need to do better, and this is my small way of playing a part in that. People with diabetes need to thrive and not just survive.
Reva, thank you so much for telling us your advocacy story. And Deirdre, if you could tell us your story.
Sure. Hi, everybody. I'm so glad to be able to participate today and excited to see faces, Reva and Louie and Veronica, because I haven't physically seen them in a long time. So happy to be here today. So a little bit about my story. So I was diagnosed with type 1 diabetes as an adult. Had no idea, didn't know anything about diabetes. Nobody in my family has it, none of my friends, nobody in my friend circle. All I knew about diabetes was the little kid I used to babysit when I was in high school who had diabetes. And, so I was limited what food I was allowed to give him for snacks. That was really all I knew about diabetes. I didn't know anything else about diabetes. And so when I was diagnosed, it was like, that's a big life hit, right? As Reva already explained to you, it's 24/7, 365. It doesn't go away. I can't stop it for 10 minutes to think about something else. And so I sought out places I could learn information. I was like, okay, I literally know nothing about this disease that all of a sudden I've been diagnosed with. And so I spent a lot of time doing research and found ADA in doing all that research. Their website has an amazing plethora of resources and materials, and then got linked in volunteering wise, got linked in right away with the Step Out Walk that was going on here in San Antonio. Actually, it's a funny story. I had just been came out of the hospital, and 2 weeks later, the department that I worked for here at the city was like, hey, you're our new team captain for our team for the Step Out Walk. So I didn't get a whole lot of choice in that, but it was fun to do anyway. And I was glad to be able to do that. And they figured they now had a face to use for our team. So I'm one of those people. I've always been super open and outgoing about the fact that I live with this disease. I use an insulin pump. I use a continuous glucose monitor. I wear that device on the outside of my pocket, hanging off my waist or hanging off my pocket. So it's out there in the open. I'll sit down in a restaurant and I'll grab the side and I just whip it out and start playing with it to give myself my insulin before I eat. So I'm not shy about doing that. And one of the things that I found in doing that, whether I'm on a plane, in an airport, in a meeting at work, or with my group of friends out to eat, is that it gives me that ability then to talk about it. It gives me that ability to create awareness in my circles. And so for me, that's what I look at advocacy as being, beyond just the advocating for money, which is important, is being able to just give those awareness messages to try to bust the myths that exist out there about diabetes, about what I am and am not allowed to eat, and what exercise I can and can't do, and when I can do that, etc. that really learning to be the boss of my blood sugars, right? So learning new information all the time about how do things work. The reality is everything affects it. Yesterday, this is going to sound really stupid to people that don't know, but to those of you who know, I was watching a movie. I became very emotional at what was going on in the movie, and literally my blood sugar started skyrocketing. And I was talking to my friend. She goes, "Why is your blood sugar so high?" And I'm like, "Because the movie made me super emotional. Those hormones from the emotions cause an issue with the blood sugar." So, but getting those awareness messages across to people are so important. As Veronica mentioned, I work in public health. I work for our local health department here in San Antonio. And while I don't have a direct pulse and finger on the work that we're doing in the arena of diabetes, I have that ability to be able to send messaging from a personal perspective to those folks who are doing that work. San Antonio, twice the national average of people living with diabetes. It's higher even than the state numbers. So I think that state number was 11.2%. Here in San Antonio, it's over 14% of our adult population that lives with diabetes. So, it's real important. I've worked with seniors who are living on fixed incomes. And so those are the folks who need the help. I've been very blessed. I've said this time and again to even the people who are on this panel today. I've been very blessed to have amazing employer-provided insurance that I haven't had to suffer the way people like Reva and other friends that I have nationally who struggle to afford their insulin. I haven't had to do that personally, but I can have that empathy and feel for them with the knowledge of how much it does take and how much effort goes into it. I can't imagine if I was also worried about how I was going to pay for it. And so that's why I advocate. I'm there for those who can't advocate or who aren't able to speak up themselves. So my goal is really always to be that voice for those folks. And thanks again, Veronica, for including me.
Absolutely. Thank you to all the panelists for those very interesting and inspiring remarks. I am now going to discuss advocacy at the American Diabetes Association. First slide, please. We first start with our mission, which is to prevent and cure diabetes and to improve the lives of all affected by diabetes. We have 3 priority areas: equity, access, and affordability, food and nutrition, and research and innovation. Next slide, please. Under the equity, access, and affordability priority, we work to reduce the costs of and the payment barriers to diabetes drugs, health insurance, hospital care, and devices. To boost access to quality healthcare providers, to break down systemic barriers to equitable diabetes treatment, care, and prevention for children and underserved populations. Next slide, please. In the area of food and nutrition, we work to improve the quality, availability, and affordability of healthy food and drink for children, low-income Americans, and others at risk for diabetes. We promote culturally appropriate resources and education to make healthy food more accessible. Next slide, please. In the area of research and innovation, we work on ensuring a robust U.S. commitment for research into diabetes treatments and cures, to address gaps in clinical trials for people with diabetes, and to promote access to safe and effective medical innovations that will improve the lives of people with diabetes. Next slide, please. A key area of our work is our efforts to make insulin affordable for all. Insulin is a matter of life or death. Insulin isn't optional. The price of insulin rose dramatically during the past 2 decades, nearly tripling between 2002 and 2013, and continues to rise since then. We need to make insulin affordable for everyone who needs it. Next slide, please. ADA conducted a study in conjunction with other partners and found that insulin affordability impacts people's ability to manage their diabetes. The study found that 1 in 4 insulin users have said cost has impacted their insulin use. 36% of insulin users choose between insulin and other medications. 30% choose between insulin and utilities. 27% choose between insulin and housing. 26% take less than prescribed. 23% miss doses weekly. And also 23% switch to less expensive brands. Next slide, please. In this next slide, I will share some of the steps that ADA has taken to address this issue at the federal level. ADA raised the profile of the insulin affordability crisis with members of Congress, leading to hearings, reports, and increased media exposure for this issue. A new option was created for the federal Medicare program for seniors and the disabled, providing the option to choose plans with $35 a month insulin copays. We also wanted to let you know about a major bill being considered in Congress, the legislation referred to as the Build Back Better bill. The legislation covers many areas of policy, including health policy. There's numerous provisions addressing health insurance and drug affordability, including a proposed cap of $35 on insulin per month that would apply to prescription drug coverage for seniors and private health insurance plans. The legislation is still pending, but would make a huge difference. Next slide, please. Now, let's talk about efforts at the state level. In 2019, Colorado passed the first insulin copay cap applying to commercial health plans. These are the plans that states can regulate. Since then, copay cap laws have passed in an additional 19 states and Washington, D.C., helping to improve affordability and helping to drive the consideration of caps at the federal level. Other laws were also passed, including more affordable insulin for the Utah public, as negotiated through the state employee program, and legislation requiring manufacturers to provide low-cost insulin either for an emergency supply or throughout the year for those facing affordability problems. These laws passed in Minnesota, Maine, and Colorado. And this year, we were thrilled to pass an insulin copay cap law right here in Texas. It's a $25 cap on monthly copays per prescription. Next slide, please. Now, I wanted to touch on health insurance access. While insulin affordability is a core problem for many in the diabetes community, too many people with diabetes face even broader issues with access to care, inclusive of the medication needs. The COVID-19 pandemic has highlighted these difficulties and disparities. ADA called on elected officials to work to address health insurance coverage to support people with diabetes in maintaining their coverage or gaining new coverage in the face of the pandemic. We also called for improved access to testing and for access to vaccines once developed, given the vulnerability that people with diabetes have to the virus. Next slide, please. Continuing our work on improving health insurance access, the American Rescue Plan, ARP, passed earlier this year, providing critical support for accessing health insurance coverage during the pandemic, including improved eligibility and subsidies for marketplace health plans and funding to allow people to stay on COBRA plans with no premium costs. States that had not expanded Medicaid, as is the case with Texas, were also further incentivized to do so. And now some of the temporary support that were enacted in the ARP could be further extended under the Build Back Better plan previously mentioned. This would include new subsidies for accessing marketplace plans that are targeted at helping people who would have qualified for Medicaid if their state had actually expanded Medicaid. Next slide, please. ADA continues to push for access and affordability. The pandemic has only further highlighted disparities in access to care across our country, including great differences in health outcomes. To provide further focus on these issues, the ADA has launched our Health Equity Now campaign and its related Bill of Rights, detailing some of the areas needing the most attention. And you can find this at diabetes.org/Health Equity Now. And 2 weeks ago, we held a Cost of Care Summit to help address affordability and barriers across the spectrum of care needs for all people with diabetes, whether medication, devices, or healthcare services. Next slide, please. In the area of research and prevention, ADA continues to advocate for funding in the annual U.S. budget to address diabetes prevention work led by the U.S. Centers for Disease Control and Prevention, and diabetes research towards a cure and improved care led by the U.S. National Institutes of Health. We also advocate in support of a 3-year reauthorization of the Special Diabetes Program that passed last December. It provides $150 million in annual funding for type 1 research and $150 million for improved diabetes prevention and care for Native Americans, the population with the highest prevalence of diabetes. Next slide, please. The one before, please. The one there you go. I did want to mention our Safe at School campaign, which works to make schools, daycares, and camps and other programs safe and fair for children and young people with diabetes. We equip families, school personnel, diabetes providers, and other caregivers with resources, education, and training to ensure schools can safely meet the diabetes care needs of youth with diabetes. Now, next slide, please. And now we are going to turn to the Texas diabetes-related advocacy wins achieved with ADA support during the 87th regular session. The first, of course, is the insulin copay cap legislation, which caps insulin copays at $25 per prescription for a 30-day supply. The sponsors for this bill were Chair of Senate Health and Human Services, Senator Lois Kolkhorst, and State Representative Eddie Lucio III. The legislation had broad support from both the House and the Senate, and Governor Abbott signed it in June. It will apply to state-regulated policies next year. I also wanted to quickly go over some other legislation that may be of interest. HB 18 by Chairman of the House Insurance, Tom Oliverson, establishes a program for Texans without health insurance where individuals will be able to purchase some prescription drugs at the post-rebate price. HB 4, it opens up the option for Medicaid recipients to receive telehealth services. Next slide, please. HB 133, it continues postpartum coverage for 6 months. It's an important benefit for those with gestational diabetes. HB 1935, it gives pharmacists the authority to dispense a 30-day emergency insulin supply. HB 2509 was one of the last pieces needed to establish the first podiatry school in Texas. And HB 3459, which streamlines prior authorization requirements and removes some barriers for certain services. All in all, a pretty good session for diabetes-related legislation. We end, the next slide, please. We end with actions that you can take to support advocacy. Act on ADA action alerts by sending our template emails to your legislators to urge their action on policy issues important to the diabetes community. You can also write a letter or make a phone call. You can advocate with legislators through social media, and we sometimes include template language for doing so in our alerts. Next slide, please. And this is how you can sign up to become an advocate if you had not already done so. diabetes.org/advocacy/become-an advocate. You can also sign up to become an advocacy influencer at diabetes.org/ADA influencers. Advocacy influencers are people who want to make a deeper commitment to advocacy, to do more than act on alerts. This may include being invited to meetings or town halls, or being asked to engage with the media to lend support. And that is the end of my presentation. Thank you so much. And now I want to bring the panel back in and give each panelist 2 minutes for their thoughts on this question. What would you say to people who are not engaged in advocacy but are considering it? Let's start with Deirdre, then go to Louis, and then go to Reva.
So I think the first thing that I'll say is that it's not as hard as you think it is. Everybody makes an assumption that it's really hard to do this kind of work. It's not really that hard. The hardest part is getting the meeting. That's the hardest part. And really that just takes some effort. It takes a lot of emails and phone calls to the schedulers for those folks representing us in the Congress and the Senate in order to get on their dockets and get on their schedules and get those meetings with them. But as Veronica said, you can take action by sending an email. You can send emails, you can write letters to the editor. All of those are things that you can do that aren't that hard. I will tell you that when I was originally asked to be the advocacy chair in San Antonio, I was like, oh no, I can't do that. And I say that from a perspective of having a parent, a mom, who is very involved in advocacy work at the state level in Virginia, not for diabetes, but for other things. And so I've seen the work and the effort that goes into being an advocate. And I was like, oh no, I can't do that. I have a full-time job. I don't have the time to do this, et cetera. And here we are, I don't know, 8 years later, 9 years later, something like that. And I'm still here, still doing the work, still putting in the effort. It's making that decision that it's important and that it's important to you. And it can be as little as writing an email. It can be as much as, hey, I want to go to DC on the day that the organization is going to be on Capitol Hill and advocating in person with Congress and with the Senate. So there's place for everybody. And there's people like the four of us on this panel right now willing to help you.
Thank you. Louis?
Yeah, if you're considering being an advocate, I will tell you, we need you. We need you. We need your personal stories. I have personally been witness to an individual's telling their compelling personal story that has changed the hearts and minds of legislators across the country. As we heard from Deirdre and Reva, diabetes is a struggle, and until we can successfully win support by helping individuals that are policymakers understand the challenges that exist for individuals with diabetes. The best way that we can do that is by helping them see outside of their own perspective, to understand that there is a lens for which they can view how their decisions, whether serving on certain committees or with the vote that they take in their respective chambers, that is the best way to change hearts and minds that help support policy that will help support you. And so if you are considering being an advocate, we need you. We need your voice. It's not just Veronica and Reva and Deirdre and myself. We've got an army of individuals across the country that participate in this way, but it's not enough. And we've all been doing this for a long time. And part of the reason why we've been doing it for a long time is because we need more people to help and step up and support. And I can't tell you the how great of a value it is for policymakers when they can hear more than just a few voices advocating on behalf of good diabetes policy. So I'm going to say it one more time. If you're considering being an advocate, we need you. Please join us.
Thank you. And Reva.
Yeah, thank you. I completely echo everything that Deirdre and Louis said. You know, I also want to add that these Congress members are human too, and sometimes it can be seen as an intimidating thing to go in and share your story with them. But diabetes touches everyone. Everyone knows someone with diabetes, and when they hear your personal story and you pull at their heartstrings, they empathize with you. They want to help you. They're just like everyone else. So I want to show an example of what I mean. Bear with me. So what you see right here is me testifying in Austin. And this room looks like a huge, intimidating room. But when you actually sit down at the table and you look them in the face and you see their reactions when you're telling your story, they're just like everyone else. And as you go and you share your story over and over again, you obviously become more confident. People start to recognize you. You build these personal relationships with these Congress members. So if you want to get involved, if you need someone to hold your hand, we're the team for you. The ADA is here to help you share your story. This is a great platform to utilize. I went and I had the opportunity to speak with Representative Rico, and he shared his story. And if you could just see the people's, like in the audience, their reactions, a lot of people hadn't heard Representative Rico's story before. And when he shared his personal story and I had the opportunity to share my personal story, it went viral. Imagine the amount of people we are touching with just sharing our stories. And by sharing our stories, we're truly able to help people thrive and not just survive. So that's, my spiel on if you want to be an advocate, even in the smallest way, just share your story on social media. You'll help somebody, really own their disease.
Thank you to our panelists and audience for sticking with us. And now I would like to open it up to a Q&A session. And I first want to start with a couple of questions that I have for the panel. And then please, if the audience has questions for us, please put them in the box. Louis, I want to mention, based on your background as a staff person at the Capitol, does sending an email to a legislator really work? Don't legislators get too many emails and too many people asking them to be for this or be for that? Why does that work?
Yeah. So does it work? 100%. It does. And look, you're absolutely right. Legislators get inundated with phone calls and emails and letters and text messages, and it is a lot to manage. It's a lot to sift through, but it works. And I want to tell you why. Legislative staff, individuals like myself, are there in the support of policymakers to compile all of the different inputs and distill it for them in a way that helps them come to the best conclusions when they are deciding to support or oppose policy. And it's not just a numbers thing, because the information that is provided, the inputs that come in from individuals that legislator represents. There's someone from staff reading this, creating a metric behind it, helping to figure out if there is a personal relationship with the legislator, and that will cause a need for some attention, and really at the end of the day, those comments, those personal stories that you provide in your email or in your letters or in your phone calls, they all get put into a briefing document for the legislator to consider when he or she is reading through the analysis of the policy that is being proposed, and they look at the recommendation from the staff. There is a place in there that provides for comments and metrics on individuals that call in. I know it is very easy to feel that government may not be working for you, or if you send an email or make a phone call, no one is listening. I want to tell you today, that's just absolutely not the truth. There are people listening, taking your information and distilling it so that the person that represents you in your state legislature or in Congress can help make the most informed decision they can about whatever policy is in front of them. And it's also your ability to create citizen accountability, right? Because you've contacted them and you've asked them for support or opposition, and so it helps create an ongoing dialogue as an advocate with the individuals that are elected to represent you.
Thank you so much, Louis. And now I have a question for Reva. Reva, you are a very busy woman. How do you find the time to run a business, have a life, and be an advocate? Doesn't that take up a lot of time?
It actually doesn't take a lot of time, you know. I'm passionate about advocating for people with diabetes, so I make it a priority. And I've been able and had the opportunities to integrate advocacy into my business. So from a digital marketing perspective, I love broadcasting about diabetes and advocacy efforts. And honestly, just the only time consuming part is maybe going up to Austin. So for example, in the past few months, maybe took me 2 hours and then an hour there and I was gone. And so it's like one day out of, 365 days. It's not a huge commitment. It's something I'm passionate about. When we get to do these press conferences and talk about our stories, these interviews and press conferences and just any sort of publicity we can give to advocacy is so important that I don't think you can put a time constraint on that. It's just so important. You have to give the time and the effort to provide a better life for people. So to me, it's not a time commitment. To me, it's like I would do this all day, every day if I could.
Thank you so much. And I want to add on this that the storytelling portion of this, when Reva and we had other advocates go to the Capitol and advocate for the insulin copay cap bill, that made the difference. That absolutely made the difference to these legislators at the state Capitol when they heard the stories. And that is why this law had so much support, because they listened to people like Reva and the other advocates that we had. So it was obviously very important, and it changed policy in Texas. And next I want to ask Deirdre, what are the common misconceptions people have about having diabetes? How can we combat these misconceptions and communicate more effectively?
Great question. And I like previewed it already, right? I said I do a lot of myth busting. There's so much out there, and in the arena of public health, where we're discussing, the challenges of obesity and what that looks like, the challenges of other communicable diseases and that kind of thing. Obviously, we've been ultimately pinned in and focused on COVID for a very long time now, it feels like. But ensuring that people out there understand that diabetes is something that's here, right? So, and kind of communicating that. So I'll tell you, early in my diagnosis, early family Thanksgivings. Oh no, well, we need to have sugar-free cookies for Deirdre, that's the reaction, right? And it's simply because they don't know. They're trying. People come to their opinions about diabetes purely from a perspective of caring for the individual with diabetes, and I fully recognize that. And so, like, really working to help people understand better what are those things. And so, like Reva, I use my social media platforms a lot to just kind of get that messaging out there. I use my own personal, as I said earlier, it doesn't faze me to whip out my pump. In the first year, it didn't faze me to lift up my shirt a little bit and give myself a shot while I was sitting at a table in a restaurant. Does it freak other people out? Probably. Do they probably wonder what the heck is this girl doing with a needle in a restaurant? But for me, I need people to know that this is what I'm living with and dealing with. I was still in school at the time, so eating dinner in my grad school classes, and people are like, how come she gets to eat? And so it's my opportunity then to explain it to people and say, look, I don't have a choice. I have to eat the same time every day. Now that I'm on a pump, I don't have to do that. Thank God. I can rearrange schedule. I don't have to eat on that schedule anymore. But learning about those things and being able to educate other people about those things, I think ultimately will get to a point then where people understand what diabetes is and understand the signs to look for to protect themselves. I mean, I don't know what that exact number was going across the banner on the screen, right? But people are living with pre-diabetes. They don't even know it. There's so many millions, literally millions of people. Oh, here we go. It's running again. Millions of people across the United States and 7 million or something like that here in Texas. So they don't even realize that they have it. And so educating people to understand the signs, to understand how to take care of themselves better, is really important.
Thank you so much, Deirdre. I would like to thank the panel for joining us today. Thank you to Reva, Verma, Deirdre Murphy, and Luis Sanchez for sharing your stories and your expertise. Thank you to everyone for joining, and special thanks again to our sponsor, Humana and the McGovern Medical School at UT Health, Department of OB/GYN. With that, remember to join us every day this week from noon to 1 p.m. Central for our 2021 State of Diabetes virtual lunch series. Be safe, stay healthy, and have a great day. Thank you.
Inequity isn't invisible. To see it, all you have to do is be willing to look. Education, housing, income, and access to healthcare are underfunded and undermined for people of color and others who are underserved. The result? Systemic health inequity. In fact, a cynic might note that wealth equals health. Look no further than diabetes. It increases the risk for other serious illnesses, including dying from COVID-19. Diabetes is the bellwether not just for the health of our communities, but also for the health of our healthcare system and the health of our society. The inequity causing diabetes isn't invisible. The burden isn't shared. From those who are most likely to live with diabetes to those most likely to suffer complications, and the Americans most likely to die from it. Confronting the reality of diabetes is confronting the reality of health inequity in America. Inaction is no longer an option. Health equity is a right, not a privilege, no matter your race, income, zip code, age, or gender. It's time to demand health equity now.